This day and age, a smartwatch can do more than just track your steps. New apps and tech are giving you more than your heart rate, even your blood pressure. And today we're asking, is this really a reliable way to track your health? So of course, the most important person to talk to is somebody that's a cardiologist and our 9 News medical expert, Dr. Coley. So you've got one on.
Yeah.
And do you use it for that very reason?
I do, honestly. And I'm, as a cardiologist, a huge fan of wearables to really track patients' health because, number one, it raises awareness for the patient. So I have patients, for example, that don't know that they're doing certain activities, arguing with their children, watching the news, doing whatever that raises their heart rate, and it triggers them that their heart rate is too high. I also have people with chronic diseases who it helps to kind of monitor what's happening. For example, my patients with AFib, it kind of tells me when they're having AFib, when they're not. And for some people, it can even help to make a new diagnosis, such as sleep apnea, where your oxygen levels go down when you sleep.
So you find them accurate?
So here's the caveat. You have to know the limitations. And of course, as a physician, I know the limitations. But even as a patient, you have to understand the limitations because it's not medical grade accuracy. So the Apple Watch has an AFib algorithm that tells you when you're in AFib that's FDA cleared. A lot of times patients come into the office and say the AFib alarm triggered. I put a EKG on them or a heart monitor. It's actually something called PVCs. So anything that makes the heart rate irregular, the watch thinks is AFib. But there's many different kinds of arrhythmias that are not AFib that can make your heart skip. So
just so people know what AFib is, if you could, because you mentioned it, just let people know.
Yeah,
what
so
you're talking
AFib is an arrhythmia we get worried about because it can cause stroke. It's where the heart is irregular, and it's irregularly irregular. So every beat looks a little bit different because the top chamber is fibrillating. That's very different from a PVC, which is someone startles you, you just have a single skip. The watch doesn't know the difference. It sees the heartbeats are not regular, it triggers an AFib alarm. So what it does for me as a physician, it prompts additional testing. So I don't rely directly on that evidence, but I use it to test people.
So it's a good thing if you get one and you go see the doctor and find out what it means, right? Do you have a preference of devices?
Yeah, it's a great thing, in fact. So I recommend a few different devices. If you are older, I generally recommend either the Apple Watch because it has an arrhythmia monitor, like we talked about, or something called Kardia, K-A-R-D-I-A, which is a cell phone case where you can actually get an EKG. So you're out hiking in the mountains and you feel something funny, you snap an EKG on your phone and you send it to me so that I know exactly in that moment what your heart was doing.
With an Apple Watch, like if you have an incident that you feel or it tells you're having an incident, it's recorded so that you as a doctor can see the data?
So you have to trigger the recording. If it has an algorithm where it self-records, it sort of surveils your heart. But if you feel something, you go to the app in there that says EKG, and not just the heart rate. I don't want to just know your heart rate. I want a strip of what your heart is doing. So that's really very helpful. So, you know, when you're talking about heart rate monitoring, the accuracy is pretty good for most of these devices, Fitbit, Apple Watch, even the Oura Ring, about 3 to 5 beats per minute at rest. When you start exercising, you're doing kickboxing or moving your wrists around too much, that's when the accuracy starts to go down. Oh. Also in darker skinned people, the devices function less well because it's using optics to go through. If you have a tattoo or you're wearing nail polish or you have any other discoloration on your skin, that can affect it.
And the Ring devices are as effective as the wrist devices?
So the Ring devices are really good for sleep monitoring, which is kind of the new trend that everybody's trying to do. And they're about 80% accurate as compared to an in-hospital sleep study. So I wouldn't say 100, but oftentimes it can tell us whether your oxygen levels are going down during sleep, which would then trigger the formal testing, like I said. So I sort of use this as kind of, you know, raising awareness, including the glucose monitors, which tell people they eat oatmeal every morning. They think they're being healthy, but it's actually causing that sugar to spike. And then I end up doing kind of more intensive medical grade testing. So it's a good screening tool, but not necessarily a good sort of, you know, monitoring tool.
If nothing else, starting a conversation that could prove to be important.
Mm-hmm. For sure. And I think if you're somebody who gets, you know, more information is better. If you're someone who gets really anxious with data, then it can actually drive bad behaviors. I had a woman who kept checking her blood pressure, and I said it kept going up more every time she checked it. And I said, stop checking it. That's the intervention.
That's how it works.
So you want to know your own psychology, but these new devices are a friend. You want to talk to your doctor before using any device or relying on it, of course, to change your medications and such. But I'm, as a physician, really relying on technology to be my eyes and ears for my patients.
We'll continue to learn more. It's good to see you. Thanks as always. Of course, you can find more with Dr. Coley. Go to 9news.com/Dr. Coley.